It's time for another carrier product update. Tune in as we talk directly to the carriers about their new plans, any new network options they have, or which plan designs offer the most savings, and learn about the tools and resources they offer to help you generate more business. Visit our website to learn about all of the carriers we quote in our Carrier Product Update series.
Hello and welcome back to our Carrier Product Update series. It's our Q4 Kickoff Summit. My name is Jason Powers, and I am excited because Derek Bradford from Trustmark is live in studio to join us. Welcome to the show, Derek.
Thank you. Thank you for having me.
Appreciate you flying all the way in from Chicago, bringing the knowledge of Trustmark to our broker community and to our broker partners out there. I know we're really familiar with Trustmark. We're a licensed general agent, managing general agent, I think is the level of contract we have with Trustmark, which means with brokers out in the community, when we quote your Trustmark business, we don't cost you or your clients anything. You get 100% of the production credit, 100% of the producer compensation. So we appreciate the opportunity to show you Trustmark in the future. There's probably agents out there that have never seen a Trustmark quote or have never worked with Trustmark in the past. What would you say as a company really defines where you guys are in that space of employee benefits?
Well, we specialize in level funded products, down to 5 enrolling, up to 250 enrolling. I think we've been in the space longer than most.
Yeah.
So in the small group space, longer than most. So I think our story kind of resonates. Small business is our business. So we believe that's our handle.
Yeah, no, and it shows in every way, shape, and form. From the flexibility of the product and the plan designs to we'll get into some of this other stuff like flexibility in the way that the stop loss contract is built, the different surplus options that you've got, the massive amount of networks that we can choose from, the different ways that the flexibility in product design that we can quote. So excited to have you on to share your wisdom with brokers as they head into just a crazy busy time of year for everybody in this industry. So without further ado, I know you've got some slides here. We'll jump right into them.
All right. Excellent. Yes. Legacy Brokers and Trustmark has been partners since 2015.
Yeah.
So we're almost a decade in here. Together we work to provide expertise and level funding and support and personalized service needed for brokers and their success. And then Legacy's been, we work directly with you guys for quoting, pricing, enrollment, underwriting, support, and service. So full service.
Yeah, all the things that we do, you guys do a great job on the back end of supporting all of our efforts. It's a good partnership, and we appreciate it for sure.
Yep. Now, who is Trustmark? Who is Trustmark? We get that question quite a bit. Trustmark, if you look us up, Trustmark actually started in 1910. So about 113 years in.
Yeah.
Been around a long time.
I was told there'd be no math.
Right?
So.
Yeah. Been around a long time. A lot of people don't know that. We don't actually own a proprietary PPO network or doctor arrangement. We lease those arrangements.
Sure.
So for that reason, we don't have the commercials and the billboards of everyone else. But we've been in this space quite a while, over 50 years doing just group health.
Yeah.
We're doing fully insured and transitioned all of that over after ACA and healthcare reform. Transitioned everything over to level funding, so everything's level funding now. We actually got almost 4,000 full-time and part-time employees, $2.8 billion in assets. Trustmark, underneath the Trustmark umbrella, there were 4 companies. We sold off one of them the end of 2021. That company was called Health Benefits, also known as CoreSource.
Yep.
Years ago. They do large group TPA administration for larger groups, for self-funded groups. We sold them off, and now the last 3 companies we have Health Fitness, which they specialize at putting fitness centers in big major corporations, Fortune 5,000 companies, biometric screenings they do for employees to get them discounts. So they go out and do all that. You may hear the Trustmark name, and it could be one of the other companies, but that's why I'm mentioning these other ones, just so you kind of get a feel for it. The other company is Voluntary Benefits. We call it VBS. They're the 3rd largest VBS supplier in the country. There's a couple of states where we're like primary. We do all of their voluntary benefits because of the laws where they're written. So that's another company we have. And then my company is called SBB, which just stands for Small Business Benefits. And it's all level funding from 5 to 250. Now, Trustmark's got an A rating. We just got bumped up from an A minus to an A excellent with a positive outlook. We can't grab an A plus because we don't sell life insurance policies. You got to have certain, for AM Best release, you got to have all these other divisions in order to get that. But the A is high as we can get, and we're excited about that. Got that about 90 days ago. And then as a company, like I said, 113 years now. I think it says 110, but 113 years now. And our goal is just to offer solutions to help enhance the well-being and provide greater financial security for every employer group and their members.
Yeah, and so some brokers out there may have been familiar with Trustmark Small Business Benefits as Starmark back. I think when I first started my career, it was always Starmark, which was Star Marketing Administration, I think. Mm-hmm. But Trustmark has been the flag for the last 4 or 5 years. I feel like is when that name change occurred. And it certainly is a staple in our quote activity and our quote delivery for brokers out in the community.
Yeah, we were Starmark, a Trustmark company.
Yeah.
And then someone came in and said, "Well, you can't keep doing a Trustmark. You got to bring some synergy amongst." Yeah, and that's where all the divisions kind of coming together. Sure. With the same Trustmark brand.
Yeah. A little bit about what you do, right?
Yeah, what we do. We deliver big benefits to small and mid-sized businesses with 5 plus, as I mentioned, 5 plus employees, provide level funded solutions, successfully used by larger groups. So when we had that other division called Core Source, they did large group administration. So a lot of what they did for larger groups, we brought that same platform down to smaller groups, which is why we've been doing level funding since 2006. We were doing it in a small group space in about a half dozen states that had community pricing. We went in with our level funded product before ACA, before healthcare reform. So once healthcare reform became law, you would say, we transitioned everything over. We had already saw the profit margins were better there. It was a better approach for the employer groups. They had more skin in the game, opportunity to get some money back, lower renewals. Yep. They were all lower renewals, and everyone wants lower renewals these days. So it was a great fit for us and perfect timing, and we just transitioned everything over.
That's great.
No, this is probably our secret sauce. I believe it's our secret sauce. I've been with the company, and I didn't talk about myself a whole lot. I've been with the company since December 1st of 2007. I'm rolling into my 16th year. Over that time frame, I've helped producers like your broker community issue over $100 million of level funded business. Wow. And like I say, we've been doing it all that time. Yeah. I cut my teeth on it right away, spent some time at Great West before coming to Trustmark, and kind of knew the platform of level funding and max corridors. So it was easy for me to just kind of talk about it to producers. And it was a different story. It was a differentiator. So they was all over it. Like, oh, can I do this for this client? Long as we were at the renewal or better, it made no sense not to take us. Yeah. Because we had that skin in the game. About a third of the premium was level funded dollars that the employer can get back. And then back then we did 100% refund. And now since other carriers have gotten in this space, we transition. We still offer 100% refund to our clients, but they can go 100%, 1/3, 2/3, or 50-50. Now they got options they can look at. Of course, 50-50 is going to be the best price point, and usually from the bottom to the top, from 50-50 to 100% cash back, it's about an 8 to 12% spread in difference. So if you get a solid renewal, you want to go to 100% cash back, you're good to go. But this slide really talks about what I think is the delivery package for every producer out there. When you say, what can I bring to my client that's unique and different? We're one of the few carriers outside of some local TPAs in certain markets that can offer a PPO plan with a copay, a PPO plan with the high deductible HSA style, and RBP with the copay could be identical to the PPO copay plan, and a RBP HSA high deductible plan identical to the PPO plan. All on one platform, along with the MEC plan, minimum essential coverage. You're talking a price point, a minimum essential coverage plan, price point runs $60 to $70 a month, and you can get all the way out to the PPO full-blown plan at $300-400. So any employer group, whether it's 5 employees or 250, have the ability to have a price point for every employee within the company. Pick and choose what you want. And on top of all of that, if an employee buys our RBP, and I haven't seen this from my competition, so I'm going to say it right now for you guys, for legacy brokers. If a member is on an RBP plan with us and there is so much noise that we can't diffuse for that member, we will allow that member to make a one-time change over to the PPO plan the first of the following month. Now, of course, there's a price point attached to that because RBP plans are generally 15 to 35% lower on an exact plan design than a PPO. But we'll allow that member to do a one-time switch. If it's just too much noise, I haven't had it happen yet, but it's the best piece. We want them to be comfortable. We want them to know it's user-friendly. Half of our block of business is RBP, so it's a big deal to us. It's better claim cost containment that we do on that side of the house to try to mitigate claim spend for all of the groups, which turns into better renewals if you can mitigate the claim spend. Wow. So we would like to see every client at least put in an RBP. Maybe 25% of your population goes RBP, 25% goes PPO, another 25% goes MEC. Whatever your situation is, your 50-plus group, you got to put it in the MEC to avoid the mandated penalties. We can put that all in one package for any size group. And I don't think our competition is doing it.
No, I'm not seeing it at all. So you're saying as long as the employer is offering a PPO plan design alongside that RBP,
sure. If
right?
they install it, you need one member to install a PPO plan. If you got one person on it, anyone on the RBP can switch over if they had too much noise or just didn't like the RBP program.
Yeah, wow, that's a good safety net for members. It's a good safety net for brokers to know as they're taking those options out to their clients. So, yeah, that is unique to Trustmark for sure.
And it brings down the employer contribution level. If you think about it, if half of your group or 25% of your employees are on the RBP, you're already reducing your contribution level by putting them on that plan. Yeah. And maybe you have them pay the buy-up to the PPO, the differentiator, until you get a solid renewal or get some renewal surplus dollars to offset that. Yeah. And now in the second year, we're a long-term solution. A lot of these groups look at this as, if you've been on the fully insured model, maybe some of the blues, every year you got to go back. But there are solutions within our product that you stick with us. Average group stays with us 3 to 7 years. So you got a 3-year mark. If you're doing it right the first time, put this in place, maybe you get 10, 20% of your population on RBP. Come year 2, that may amp up because now they're talking about it at the water cooler. Yep. I didn't have any payroll deduction, for the whole year. And I went to see a doctor and my plan worked just like your plan. Now you got more of the population coming over. Employers is reducing their contribution, reducing that spend. It's the best approach to reducing claim spend and reducing the amount that the employer has to pay in premium yearly without jacking up every deductible. Yeah. A lot of groups, a lot of carriers saying, we're going to jack up your deductible to get to the price point. You could do it here and reset deductibles. Bring them back down to where they used to be a decade, 2 decades ago.
Well, yeah, I think you're spot on. I think this gives the ability for the broker to show, a traditional PPO plan with maybe a $3,000 deductible with copay structure alongside RBP, where maybe they go a much lower deductible to entice employees going over to the RBP to get control of plan spend, pairing those two up, and then maybe even throwing some HSA stuff in there alongside a MEC. I love that. I gotta say, and we're a GA for Trustmark. I didn't realize we could put all 5 of those together, so I got my wheels spinning on some cases. Keep talking, Derek. Keep talking, man. We got some business to write.
And I didn't mention the PPO networks we primarily use are Aetna and Cigna, both of their flagship networks. We have some regional players too in certain markets, but the price point, these guys are getting the deepest discounts. They're getting like Blue Cross discounts, so they're the best to kind of put on the platform. The PPO, we do have to choose one or the other. They won't play ball together. Right. But Aetna, Cigna, usually if they're with Aetna, we write it with Cigna. When it was Cigna, we write it with Aetna, just to kind of keep it from, the contractually to try to keep it from all running together.
Makes sense. Mm-hmm. All right. Mercy, look at you.
Look, there's my information there, right? There we go, right? Listen, not a ton of slides on this. We've been here a long time. Absolutely reach out. You got questions. I'm sharing today my QR code with your staff. They literally can scan with their cell phone. It takes them to all of our brochures. It's a backdoor into our website where we have 1,000 different brochures on HRA, HSA, healthy choices, healthy edge, healthy incentives. healthcare reform documents are out there. All of the information is out there. Your team has access to it, and they don't have to be appointed with us in order to get it. Now, usually you got to be appointed to get into that path. But I shared that QR code with everyone on your staff, and they've already put it on their phone and bookmarked it so they can always go in and get to forms and send it to producers across the country.
So I want to recap though. So this is small group level funded from 5 to 250.
Yes, enrolling.
Right? Enrolled.
Yep.
From an underwriting perspective, we can do Curve, which is the AI underwriting, GRX style, down to 25 enrolled.
25 enrolling.
Otherwise, we want to do applications.
From 5 to 24. We want to do paper apps. We take other carrier apps. We take Easy App, Forum Fire, Ease, pretty much any other system out there. We'll take apps from there. Or you can use our in-house system. We have an in-house system, which a good chunk of our producers use. We actually will give, we call it Express Connect. We'll give the employer an 800 number. Each one of their employees will call in with questions that we would ask on the call. It's about 4 medical questions, 7 questions total. One is height and weight, one is smoker, non-smoker, one is pregnant or not. The other 4 medical questions, the employees will have the questions before they call us. It's a guide. They can write their answers down to the questions, call the 800 number, give them their name, their number, their address, the company code for that specific, for their company, and then they do a voice signature at the end of that process, and that locks in that employee. So once the last employee is done, the whole file goes over to underwriting. You get final rates in 48 hours, no paperwork from any employees.
Without ever putting pen to paper.
Never putting pen to paper. And it didn't cost the employee, it didn't cost the brokers anything. Yeah. They can use this system as much as they want. I've had brokers send me an email saying, hey, open the phone lines from Monday to Friday for this group. And then we'll send them an update every day of who's called in, who's left to go, till the final one is done, and we move it into underwriting. Yeah. But it's a set it and go. You can be out there, going door to door, belly to belly, having all your meetings, and you make one phone call, shoot one email. We open it up and start working that case for you all the way to the end with no paperwork.
Wow. So not only that, but then from a level funded perspective, brokers and their clients have the option to choose a cash surplus option, which is 100% surplus return after whatever run out period is
6 or 12 months.
Yep.
It'd be a 12, 18 or 12, 24, whatever they choose. Yes.
They can choose 2/3, 1/3. So a 2/3 is that 2/3 admin fee credit or is it 2/3 cash?
As admin fee credit.
Yeah.
So it'll be credit on their billing statement after 6 months. We do 4 months after the year. We do the determination to see what the dollars are. At the 6-month mark in the second year is when we start crediting. So if it was $6,000 in there, you'll get $1,000 credit on the second half of the second year. Every month they're getting
each
that
month
credit.
for the rest of the 6 months. They can also do a half admin fee credit. So 50% of the surplus returned back as an admin fee. Same kind of reconciliation time frame, same kind of credit application.
Yes.
It gets stretched out over the remainder of the contract on their invoice.
Well, they do have to renew to get the credits.
Yep.
But if they do 100% cash back, you don't have to renew. You can walk away and you get everything that's in the bucket.
Yeah, so for someone coming off of a plan where there is 100% surplus return, they're used to that self-funded sort of atmosphere, you've got that option. But for someone who maybe is baby stepping in, you've got the option to kind of start with maybe that, and you can change from year to year. That's the other thing is, as you're looking at renewals, you can start with that half admin fee credit. You can go to the 2/3 option, and then maybe the next year go to the cash surplus option and graduate to that more sophisticated self-funded space. Reporting available for self-funded clients or level-funded clients on a monthly basis.
Yes.
And then the annual report, if I recall, in the renewal packages has a little bit more detail. It talks about utilization and some of the other things. Is that, I always wondered, is that a report that we can pull on a regular basis, or like if we could request that mid-year report that's a little more detailed?
Yeah, so in our web portal for the broker and the employer, there's access to the monthly report. That's the aggregate claim summary report every month, dollars in, dollars out. They can track that so they're not shock and awed. But then there's also a report that comes out on utilization every 3, 6, and 9 months. So those are they can access those there. Now, usually they get an email from us, or you'll get an email saying your report's out there. Not every broker or client goes out and pulls it down, but those reports are out there on every case every year.
Quarterly more detailed
utilization,
reporting.
ER visits, urgent care visits,
top RX
top
spend,
stuff. Yep.
and yeah.
That's there automatically.
Okay, and then again, networks. We can use the major networks. We can also plug in RBP. In your RBP program, do we have any kind of a flex option where they've got like providers or physicians that are PPO alongside full RBP for inpatient?
We don't anymore. We did have something we call kind of a hybrid, where we had a PPO network for physicians and an RBP for hospital charges. But we had that running for maybe 2+ years. We really didn't sell any of it because the price point of the PPO and the RBP, most clients went either way, or the employer installs both plans, and the employees usually went either way. Either they were going for price, so they went RBP, which was the best price, or they went PPO because they wanted that access. They wanted the logo on their card.
Yeah.
So generally, it was one or the other. Although we had it out there, the price point was right in the middle of the two, and very few employees or employers went down the middle and said, "Well, I'll take that." We used to call it a wrap.
Yeah.
And it's good. It had a spot, and it was a great conversational piece. But in the end, they either went PPO or put both in and let employees choose.
Yeah.
So yeah, we don't.
Yeah, and again, I like the idea. I don't know if there's a name for it, but the idea of offering the PPO alongside the RBP and having members give them the flexibility at the first of the following month to move back over to PPO with the change in pricing, obviously, to the PPO product. I think that probably replaces a lot of some of those other product options that we see out there in the RBP space. So that's
right. No need for those.
Yeah.
So you can just go. If it didn't work out, all right. I mean, go to PPO. You don't want to go halfway to the hybrid.
We got to come up with a name of that. It's just like a PPO reset.
Yeah.
I don't know. Well, anything we missed? Any other value adds that we should talk about with Trustmark? I mean, you've got telemedicine built in.
Healthcare Blue Book built in.
Healthcare Blue Book built in on transparency.
Yeah.
Vitality. Talk a little bit about Vitality.
The wellness program that's built in there. A lot of the programs, we have informational data on it. Another thing, that QR code, you can get to those value add programs and just have one-page flyers or a whole booklet on it to share with the members. Vitality is one of them that comes with every plan, like Healthcare Blue Book, just like Teladoc, and the copays for Teladoc are consistent with whatever the copay is for a provider. There was zero copay on the copay plans for Teladoc, but then it's, I believe, $45 on the HSA high deductible plans, automatic. But you got a few value-added programs that are within our operation to try to reduce the claim span and maybe educate members on use the Healthcare Blue Book tool, and they got kind of the red light, green light, yellow light. Pick the provider with the best with the green light. But we got those value adds right in the program.
What about Care Champions? Can you talk about that a little bit?
24/7 customer service. I think that's the secret sauce to our reference-based pricing and why half of our block of business is RBP. Because of that, they literally, you can call them up and ask them for RBP-friendly providers in your area. They'll send you a half dozen names, and they'll actually make the appointment for you. You do your appointment, you come back, they'll follow up with you to see how it went, and they're keeping stats on everything that went on. Did it go well? Did it not go well? But since we don't have an RBP directory, I think it's like a referral. It's like a referral program. If you call us, anyone on RBP, I tell every member, just call the 800 number. You don't need to know who the doctors are. If they take Medicare, they should take RBP because we're paying above Medicare allowable charges.
Yeah.
So if they take Medicare patients, there's no reason not to get paid more on RBP. It's not a PPO rate the providers get paid, but it's more. And generally, we pay up to 150% for doctor charges and up to 175% for hospital charges. That's some of the strongest percentages in the country. So we don't get a lot of noise.
Yeah.
Less than 1% of the time, do we get any noise about the pay? Less than 1% of the time, do we get any balanced billing? Because of that, and we have balanced bill protection. So if any member ever gets a bill from us after seeing the provider paying their copay, we tell them to mail it, scan it, fax it, snail mail it to us. Within 2 weeks, they will get an EOB.
Fold it up in a paper airplane.
However they want to send it to us, we process it for free.
Yeah.
And they don't have to worry about it anymore. They have to send it to us for it to get processed, though. We won't know that they got balanced bill unless they send it to us. But once they do, we'll take care of it and send them the EOB showing it's been covered. No member will ever pay more than their out-of-pocket max on our program.
I think that's important for brokers to know about because if they are considering RBP or if they've had maybe a different experience with RBP on a client, knowing that you've got that Care Champion
Built in there.
feature built in is I think it's I think it's critical for agents to know that that's available for every one of your groups that's moving into the RBP space, having 24-hour access to somebody that can advocate on their behalf and get those people pointed in the right direction.
True. It's three main components. It's the member advocacy, the 24 Care Champion 24/7. It's the reimbursement levels are higher than most, definitely higher than a lot of TPAs, and then it's balance bill protection. That's why half of our block is there, because we're doing all of that behind the scenes. It's a very comfortable, flawless process, and everyone feels comfortable with it once they get on. But that's also why we say, if it's too much noise, switch over to the
Switch
PPO.
back over. Yeah.
And we don't have a
PPO
problem with
reset.
that. PPO reset. You go.
Yeah, you guys can use that.
The
It's
PPO
fine. It's
reset.
fine. PPO reset.
Let's get that on some T-shirts.
Yeah, right. All right. So, and I'd be remiss if I didn't mention broker comp. So broker commission. So we're a general agent. Again, producers get 100% of the producer compensation and producer credit. Very competitive producer comp. Percentage of the stop loss premiums, which is a little bit different than, say, a percentage of the total premium, but you're really just being paid on that stop loss premium. But it's a very competitive rate at that level. I think standard comes out at 13, roughly 12-13%,
something like that.
which is
13%, yes.
which I mean, when you blend it, comes out to a very, very competitive rate overall, and the total premium equivalent of a Trustmark policy. So if you're not looking at Trustmark, you definitely need to be looking at Trustmark here in this Q4. Any last words of wisdom for brokers as they head out?
I was just gonna say, for commission-wise, you do have the option of PEPM.
Oh, yes, you do.
Go,
Yeah, there is flexibility there. It's
sure.
a good point.
Yep.
Good
you
point.
can do either or.
Yep. Yep. I missed it, so appreciate you catching it.
No problem.
There is flexibility. Just let our quoting team know when we're setting up the file which way you want it run, and we'll get it run the right way.
Absolutely.
So the brokers out there are getting ready to go out and get crazy with RFPs. Any advice for them on the Trustmark side?
The best advice I can give you is give us a shot on every deal, even the flat renewals. Give us a shot. We've had a lot of rate reductions across the country. Incidentally, our product is available across the country except for 4 states. We're not in New York, we're not in Vermont, we're not in North Dakota, and we're not in Hawaii. Now, if the business is domiciled there, we can't write it. But if they're in any other state, they got employees that are there, we can write that. But give us a shot. A lot of counties across the country, we've had rate reductions in the last 6 months, multiple double-digit rate reductions, especially going into Q4 with the simplified underwriting down to 25 now. Give us a shot. If you didn't, before, give us a shot now.
Need you to start writing in Hawaii so I have a reason to go help with presentations.
I would love that, because I like to visit with you. I would love to go with you.
All right, well, you heard it here from Derek Bradford, Trustmark. Again, we are a general agency for Trustmark, so if you have any questions or need any help on any proposals, reach out to our quoting team. We'll be happy to get you that quote turned around as quickly as possible. Down below this video on our website, you'll see links to some of the marketing materials that Derek mentioned, talking about specific value-added services and differentiators, specifically probably the different funding and surplus levels that are available inside their product. You can download those materials and take them in on your presentation to ensure that you have confidence in the product that you're putting in front of your clients. Derek, thank you so much for traveling all the way out here to see us and being part of the Carrier Product Update Q4 Kickoff Summit. We really appreciate the partnership and appreciate you being here. If we can help you with your next Trustmark quote, give us a call. In the meantime, have a great Q4 and happy selling.
Thank you.
Thank you for watching this edition of our Carrier Product Update series. Visit our website to watch other episodes.